Hey skin enthusiasts, Dr. Afton Cobb here, dual board certified dermatologist and Mohs surgeon, and today I'm coming to you to talk about all things Botox. So everyone's talking about Botox. It seems to be that something most people between their 20s all the way up to their 60s are asking about, thinking about, and I'm here to break down everything you need to know about Botox. In this video today, I'm going to talk about what Botox is, what it's used for, what to expect with treatment, and what to expect with results afterward going forward, as well as side effects and when to start using it. Before we move forward, make sure to hit the subscribe button so you can stay tuned to my YouTube community. Hit the little bell icon so you can get notifications every time I post a new video, and stay tuned. First, let's dive into what Botox is. The first and most important thing to know is that Botox is actually a brand name. People use the term colloquially because Botox was the very first neuromodulator that was approved by the FDA for the treatment of glabellar lines, and that was in 2002. So it's become kind of a term like how we would think of Kleenex when we talk about tissue for the nose or something. And Botox has gotten so much popularity and recognition that sometimes we just use the term Botox when what we're really talking about is a category called neuromodulators. When we refer to neuromodulators, we're talking about products that block the neuromuscular junction to freeze the muscles, to paralyze the muscles. And in that category, we have botulinum toxin, and that's what all of the neuromodulator Botox-like products come from, is this botulinum toxin. Botulinum toxin comes from Clostridium bacteria, which can be found in the earth and the soil, and there's a whole range of these botulinum toxins with different serotypes ranging from A, B, C, D, all the way through G. And most of the botulinum toxins that we see on the market are botulinum toxin A. There is one botulinum toxin B neurotoxin, and that is rimabotulinum toxin or myoblock, but that's not used very commonly, so we won't talk about that very much today. But Botox comes from onabotulinum toxin A, and like I said, it was the first cosmetic botulinum toxin that we started using. The next botulinum toxin that you've probably heard about is Dysport. So Dysport is very similar to Botox. A lot of cosmetic practices use both of them somewhat interchangeably. The main potential difference is that Dysport tends to diffuse a little bit better. So if you're looking for very targeted places to put the neuromodulator, then you might choose Botox, whereas if you want a little bit more diffusion, say on the forehead, you might choose Dysport. But a lot of times one provider just chooses one or the other that they feel more comfortable with. The other difference is that the ratios of the equivalency of them is a little bit different. There's about 1 unit of Botox to every 2.5 to 3 units of Dysport, and so you have to do some conversions, and you might notice that as a consumer that it looks like Dysport is much less expensive, but that's just because you're having to multiply that times 2 or 3 to get the same amount that you would get from Botox. And if you see that someone's had, maybe like 150 or 200 units on their forehead and glabellar complex, that's appropriate for Dysport, whereas for Botox you might be using something less than that, anywhere from like 40 to 60, depending on how strong the muscles are. So hopefully that clarifies what is a very common question of what the difference is between Botox and Dysport. Now, there's other botulinum toxins on the market as well. There's incobotulinum toxin A, which is known as Xeomin. And Xeomin has more of just the purified botulinum toxin in it. And so for that reason, sometimes we'll use Xeomin especially in instances when someone is feeling like their Botox or Dysport isn't working very well, or the effects have worn off, and there's a thought that your body makes antibodies and neutralizes the Botox over time, and when you use Xeomin, you don't have all those extra proteins in the compound that your body makes the antibodies to. So because it's just the purified protein, the Xeomin might be good for people who Botox or Dysport is not working for. There's also a couple newer ones that have come to the market in the last few years. There's Jeuveau, which is praebotulinum toxin A, which was FDA approved in 2019. It's thought to have a quicker onset and may potentially last longer and be a little bit expensive than some of the other options. Daxxify, or daxibotulinum toxin A, is the newest product on the market in the neuromodulator category for cosmetics, and that was FDA approved for the treatment of glabellar lines in September 2022. The main difference is that Daxxify may last longer for up to 6 months. The other thing about Daxxify, and this is true of Xeomin as well, is that both Daxxify and Xeomin do not have to be refrigerated. And that's mostly important just for the practices and the prescribers, because if you're not seeing enough patients who need neuromodulators, you might opt for something that's not refrigerated, because then it doesn't go bad as quickly. The other main difference with Daxxify is that it doesn't contain any animal products or any human serum albumin. It uses a peptide technology, so that might be important for some people who have certain religious or cultural beliefs, so that they don't want to use any animal or human byproducts in products. Botulinum toxins are produced by a bacteria called Clostridium botulinum, and the toxins are very deadly and lethal in certain situations. You've probably heard about botulism. Botulism is when someone ingests the botulinum toxin, and you can see this in instances where people have homemade canned goods, because the bacteria, the spores, are heat resistant, and then it flourishes in anaerobic conditions, or conditions when there isn't a lot of oxygen, and that's when all the toxins are produced. So if you get foodborne botulinum, it's where you're ingesting these toxins. The way the botulinum toxin works is by causing muscle paralysis. And so the reason why it's so deadly when you ingest it is because if you get muscle paralysis of your respiratory muscles, you aren't able to breathe and you die. And there's various forms of botulism. There's also an infant botulism. The classic question in our medical boards and such is, where can infants get botulism from? And that's usually honey. And it's usually only in infants less than 6 months of age, and that's because they don't have the same immune system formed at that age. So anyway, at this point you might be asking yourself, why on earth would we be injecting this botulinum toxin that can be so deadly and so lethal to us? Why are we injecting it into our faces to make us look better? And the reason is that the botulinum toxin that we use for medical purposes and for cosmetic purposes is highly refined and purified and highly diluted. And that's why it's safe, and we put it in very targeted amounts into the muscles that we want them to be in. So it's very safe. We've used it for a very long time, and it's very effective. And that's kind of the history of what neuromodulators are and what botulinum toxin is, which is what's behind all of the cosmetic products that you might encounter when you're trying to do a little bit of anti-aging work on the face. For all my derm nerds out there and derm residents, the nitty-gritty details of how botulinum toxin works is that it works on the presynaptic membrane at the neuromuscular junction to inhibit acetylcholine acetylcholine release. And acetylcholine is a neurotransmitter that's released from one end of the neuron that's going to tell your muscle to work. It's usually releases this acetylcholine neurotransmitter to the muscle to tell it to work. And botulinum toxin goes in right at that presynaptic membrane to inhibit the release of acetylcholine so that the muscle won't fire. Specifically where botulinum toxin acts is on the snare proteins. The snare complex consists of syntaxin, SNAP25, and synaptobrevin. So a common boards question that we get asked as dermatology residents is, where does the botulinum toxin A act on? And the answer to that is SNAP25, whereas botulinum toxin B acts on synaptobrevin. B for brevin. So that's enough about the science lesson. Let's talk a little bit more about why we might use neuromodulators like Botox and where we would put them. To understand why we might use neuromodulators like Botox, you have to understand that the difference between static and dynamic wrinkles. So dynamic wrinkles are the wrinkles that happen when you're moving your muscles, and that's how you get lines, is a repeated movement of the muscles over time. And we call those dynamic wrinkles. When you've had dynamic wrinkles over a long period of time, such that the lines start getting etched into the skin, and then you have lines at rest, we call those static wrinkles. And neuromodulators don't work as well when you already have static lines at rest, because the way that these products like Botox work is by blocking the action of the muscle from moving. So they work very well for dynamic wrinkles. I'm past due for my neuromodulator right now, so you can see with moving my forehead, you can tell the lines that are coming up. Botox can be really helpful for treating the glabellar lines that can come up. Some people call them the 11s. This is the glabellar complex right here. So when you knock out the muscles that make you frown, like this, you can't make that action. You can't frown, so it paralyzes it, so it gives it a nice smooth look. You can also treat the forehead wrinkles, and just as a tip, you should never treat the forehead without treating the glabella, because the forehead, the muscles go like this. And so if you just treat just the forehead, you're blocking the ability for raising your eyebrows, which can potentially lead to a lowering of the brows. So it's good to also treat here, which pulls the brows down so that you get a nice counterbalance so that the eyebrows stay in good place. So you can treat the glabellar complex, the forehead. You can also do the crows, which are the little wrinkles around the eyes. You can treat the nasalis, which is the bunny lines right here. You can treat jelly rolls underneath the eye. Some people get a real prominent fold here, and you can use a baby dose to smooth that out. You can also treat the masseter, which is the muscle you see when you clench down like that. And that's the muscle that brings the mandible up and down. And so it can be really helpful for people who have TMJ, temporomandibular joint dysfunction, where they get clicking and locking of the popping of the joint, but it also can be used as a slimming effect. Some people have thicker masseter muscles, and when you inject those and cause atrophy and weakening of the muscle, it can cause a slimming effect of the jawline. It's very popular in Asian cultures. You can also treat the depressor anguli oris, which is a muscle that pulls the mouth down. And so sometimes people call that like the resting bitch face, excuse my language. But some people just have a strong muscle that will kind of turn the corners of the mouth down. And so if you inject right here, you can bring the corners of the mouth up. Another thing we use Botox for is the lip flip. You can do a tiny little bit right along the vermilion border to give a little bit of a upward lift of the lip, like a little bit of a pout, and that can be nice sometimes instead of doing filler if you want a little bit more subtle effect. And then you can also inject the muscles if you have a gummy smile. So if when you smile and there's a lot of the gums showing here, you can inject up here to bring that smile down so that it's not showing so much gums when you smile. There's a whole lot of other things you can do with Botox and other neuromodulators. You can inject along the platysmal bands, which are the bands down here. You can inject along the platysma along here and do something called the Nefertiti lift, which helps to paralyze the muscle that's pulling down. So it helps the skin to kind of snap back up along the jaw to give a nicer jawline, and that can be really a nice look for people. Sometimes we even inject Botox into the chin, into the mentalis muscle, and this is for, I don't know if I can do it. If you get like dimpling of the chin, I'm gonna just stop trying to make that expression, but I think you know what I mean. When it kind of dimples and puckers up, you can inject there to smooth out the area, and sometimes that can be a really nice effect for people who have a lot of that dimpling in the chin. Another use case for Botox is the Barbie tox, which has been trending a lot. Everyone seems to be talking about it, and it's where you inject botulinum toxin into the trapezius muscles up here, and it can lead to a slimming effect, and it can also help some people who have tension headaches. When Botox is used for hyperhidrosis or severe excessive sweating, I've literally seen it change people's lives. It's for people who are soaking through their shirts and no amount of deodorant or antiperspirant is going to help, and Botox works by temporarily blocking the muscles for the sweat glands so that they don't produce sweat in those areas. Results can last generally between 3 to 7 months is what I generally see in my practice, and it can be a real game changer for people. So I hope if you know someone who is struggling with that, whether it's sweaty palms or excessive underarm sweating, let them know that that's a potential option, that if you've tried a lot of other treatments, insurance can even cover it. And there's a range of medical options for using Botox or neuromodulators as well. They can be used for migraines. They can be used for a condition called cervical dystonia, where the head is kind of trapped in position. You can use it for facial asymmetries, like if someone has a nerve palsy that causes their face to be lopsided, you can kind of knock out the other side to try and balance out the face. You can use it for overactive bladder. You can use it for other spasmodic, twitching type things with muscle spasms. So there's a whole range of ways that we use it in medicine, and particularly when we're talking about cosmetics. In my mind, one of the main reasons that we use neuromodulators like Botox is not just to try and erase wrinkles on the face. A lot of it is about trying to improve asymmetries and to open the eyes. So you can have, the last thing you want to do is bring the eyebrows down. What's found to be really aesthetically pleasing is to open up the eyes, make the brows lift a little bit, kind of smooth out these muscles around. And so that's another goal that we're often trying to achieve when we're doing Botox and other neuromodulators. According to the American Board of Cosmetic Surgery, Botox is one of the most popular procedures nationwide, and in 2016, over 7 million people had Botox treatments. So hopefully by now you understand what Botox is and all the other neuromodulators, how it works, and where we can use it. If you're liking the video so far, make sure to hit the like button, make sure to subscribe, and pop any other comments or questions you have down below. Now I'm going to move into talking about when should you start using these neuromodulators. And the first thing is you have to be at least 18 in the US to use any of these products. So that's your starting point. And in general, I'd say people are coming in anywhere from their 20s and 30s, and I'll see them coming into their 60s and 70s asking me about neuromodulators. The perfect time to do it is before you're getting the static etched in wrinkles. A lot of patients come to me when it's already too late, and once those wrinkles are etched in, you're looking at different treatments. So that's why we'll say that if you come when you're younger, your 30s is a great time, maybe your 20s, depending on your own anatomy and your own goals. you want to come kind of in that range, because that's when the lines are starting to form. And by doing it repetitively over years, you actually can get such a softening of the muscles that you're kind of reversing the clock, right? I always think of it, if you started Botox when you're 30, then when you're 40, you've had 10 less years of those muscle actions to be etching in any lines. So it's like almost like being 10 years younger in terms of specifically the movements of the muscles. So that's when I tell people to start thinking about it, maybe mid 20s into your 30s and beyond. Once you're getting into your late 40s, 50s, and beyond, where you're getting those etched in lines, you're really looking at laser resurfacing, deep peels, and fillers is what you're getting into. But everyone's different, so make sure that you have a consultation with someone who knows what they're doing, a board-certified dermatologist, plastic surgeon, and they can direct you into the right direction of what you should do. Did any of this surprise you? If so, let me know. Drop it in the comments. Another technique you might have heard about is baby Botox, and that's a little bit different than when we do normal cosmetic Botox injections, and it might be for younger patients who are really trying to get a jump on the ball, or to people who are newer to Botox and they just want to get their feet wet and kind of see what it's like. And we use lower doses of the Botox than our standard dosing, and that's just to help soften the muscles a little bit and give a little bit more preventative treatment than actually treating strong muscles and lines that are forming dynamically already. And when we do the baby Botox, we still get some preservation of the muscle movement, so there still might be some movement, but we're just weakening the muscles to help delay it. And that's commonly used in areas like the glabellar complex, where you frown, the forehead, or the crow's feet, or the lines around the eyes. On that note, who should not get Botox? And that is anyone who is pregnant, breastfeeding, or has a condition called myasthenia gravis, which you would know if you had it. It's a condition that affects the neuromuscular junction. And if you don't have any of those conditions, you should be good, but I would definitely consult with your physician and let them know any of your medical problems that you might have before starting any procedure, really. So now you're ready to do Botox, you come to your visit, what happens? So what you can expect is that the provider will come in. They often will mark you with a cosmetic marking pen. They'll study your wrinkles and your movements and decide where they want to best place the neuromodulator toxin. They'll probably take before photos so that they can also get after photos. In general, it's very quick to do neuromodulators. Sometimes it takes a little time to get it prepared. You have to reconstitute the Botox, draw it up into syringes, and then come back in. But in general, the procedure doesn't take very long in the office. So after the provider has marked out where they want to put the injections, then they will hopefully go over how many units they want to use, give you a price, and then using an alcohol wipe prior to each injection, they'll do little tiny injections into all the points. And it really, I personally don't think that it hurts very bad. Everyone's pain tolerance is a little different. It's just a little prick, and then you'll have what might look like a little bee sting, a little redness or swollen area. That usually goes down within 30 minutes to an hour. And some places use cold packs prior to doing the injections to help numb the area a little bit. Some people use vibrating devices to kind of trick the nerves, but a lot of people don't use anything and just do the injections because they're really not that painful in the spectrum of things. What I generally tell my patients is to arrive with a clean face, don't wear makeup, it just makes everything a lot easier. And I let them know that after the procedure, They shouldn't do any vigorous exercise for the rest of the day. They shouldn't do any facial massage because you don't want the product to move into places that we didn't want it put in. And that's about it. You can go back to work afterward. You might have like a few splotchiness areas on your face, and you could potentially have little bruises in certain areas where sometimes the little blood vessels get hit. After the procedure is done, you might start noticing the effects kick in over the next 2 to 3 days, and full paralysis of all the muscles occurs by 2 weeks. So usually I have my patients come back at that time so I can take a look, see if we want to add any more, but generally the results will start around 2 to 3 days and full effects will take place by 2 weeks. Sometimes people can get headaches after Botox injections, especially new Botox users, so don't be alarmed if that's something that happens. You can get headaches, and that's something that would not be unexpected. The next thing you might be wondering is, how long does Botox last? And the answer is generally it lasts anywhere from 3 to 4 months. For all of the different neuromodulators that I talked about earlier, you're going to get a quote of around 3 to 6 months depending on what product it is. Neuromodulators like Daxxify or Jeuveau might last a little bit longer, towards the 6-month spectrum, but all of it depends on the person. Some people break it down more easily than others. Some people have stronger muscles, or they make the action more repetitively, so that causes it to wear down more quickly. At this point in the video, you have a pretty good understanding about Botox and other neuromodulators. So now I'm going to talk about the potential side effects or risks of doing Botox. In the world of cosmetic procedures and treatments, I would say that neuromodulators like Botox are some of the most safest that you can do. We've used them for a very long time. Even though Botox was first approved for the treatment of glabellar lines in the early 2000s, Botox has been around since the early 1970s and used for all these other medical treatments. So we've been using it a very long time. And in general, in the practice of medicine, when we've had something around for a longer time, it's nice because it's safer, because we understand it better. We have long-term data on safety and efficacy. And so I consider the neuromodulators, particularly Botox, to be quite safe. The main downsides that you can get after treatment, like we talked about, a little bit of pain with the injection, you might get bruising, you might get headaches, but that's really about it after the injections. The next downsides that could occur are related to where it's placed in your muscles. So if you have someone who doesn't know what they're doing, or it's used the wrong way, the worst thing that could really happen is you end up looking kind of funny. For example, if you inject too laterally, like out here when you're doing the brows, and too deeply, you can hit one of the muscles that helps open the eye. And you might have seen this in popular media. Sometimes people share their stories where they get lid ptosis, where like the eyelid just won't lift up, and that's because it's been knocked out from a neuromodulator. And there are eye drops that we can use to put in the eye to kind of try and help stimulate that muscle to make it go up so it's not as noticeable. And again, Botox lasts about 3 to 4 months, so even if you look kind of funny for 3 to 4 months, at least it's temporary. It's not going to last forever. Another thing that can happen if neuromodulators are placed too low on the forehead, or you don't do the glabellar complex as well, you can cause dropping of the brow. And I talked about that a little bit earlier, because if we're knocking out these forehead muscles that usually pull the eyebrows up, when you knock them out, it brings it down. And that can be a problem for people who really rely on their forehead muscles to keep their eyes open. And by that, I mean, some people get these kind of droopy eyelids where the skin hangs and kind of folds over the eyelid. And it happens to a lot of people. It's very common as we get older. And as a result, they use their forehead to open the eye to try and get that loose skin up so they can still see. And so if you inject someone in the forehead forehead who has that problem, they're not going to be able to open their eye as well. So it's something that we're always looking for and assessing when someone comes in. And if someone does have those loose lids here, I'm probably going to recommend that they see an oculoplastic surgeon or someone who knows how to do a blepharoplasty to take care of that excessive upper eyelid skin. Another thing that can happen when you do injections into the masseter, if you're not deep enough or you're too far anterior, sometimes you can knock out the muscles here like the risorius and knock out the ability to fully smile. If you do it too low down here, you knock out the zygomaticus, which helps draw the smile up, so you may not be able to smile as well if it's incorrectly injected here, right here. Similarly, when doing injections around the lower face or the vermilion border, if you use too much or put it in the wrong areas, you can get inability to pucker the lips or move the lips as well. You can get drooling, you can get facial asymmetry. So a lot of the risks with Botox are just temporary, and also just in how your facial expressions will look for a while. I hope you found this video useful. If you did, make sure to hit the like, subscribe to my channel, and hit the notification bell so you can get updates whenever I post new videos. If you have any other questions, feel free to drop them in the comments. And I just wanted to remind everyone that, even though we talk about all of these wonderful benefits, and there's a lot of pressure in the media and amongst our peer groups that make us feel like we have to be doing all these things to be beautiful. And the thing is you don't. And I hope that in this video it didn't make you feel like, oh my god, I have to go run and start getting this and spend anywhere from $300 to $700 every 3 to 4 months. I think it's something that you have to weigh carefully with your financial situation and with how important it is for you. I think that we can all be beautiful without doing all of these procedures, and a lot of beauty comes from how you treat other people, how you show up for the world, how you show up in the world, how you treat people, how well you treat your body with good lifestyle and exercise and healthy foods and doing good sun protection. And you can do all of these things and still have a really radiant, youthful glow as well. So if you listen to all this and you're like, wow, I'm feeling pressure to do it, I hope you don't have that pressure. Certainly not from me, but hopefully it answered a lot of the questions that you have about it. If you like this video, make sure to hit the subscribe button and hit the little bell icon so you can get notifications every time that I post a new video. Make sure to share with your friends, like the video, and if you have anything else that you'd like to ask me or things that you'd like me to discuss on the channel, make sure to pop them into the comments below. Thanks!